How to tell the difference between a scaler and a curette. These are going to be hygiene instruments, and it's important for you to know. If you're going into hygiene, you're going to learn all about this and the different types of scalers and curettes that you have. Here we're going to touch a little bit on it, not going to go a whole lot of depth. But if you remember, there are components to our instruments. We have what's considered our working end, which is the end that is going to be used to do various things within the mouth or on the tooth. We have the shank, which attaches the working end to the handle. So if we were to then draw what it would look like, we would have basically our handle, if I could draw straight, would look something like that. So handle, our shank, our working end. So when it comes to the identifying the differences, scalers are going to look pointy and be sharper. They're used for supragingival calculus and plaque removal. Supra, if you remember from med term, means above. So it's going to be used for anything above the gum tissue, which is why it's going to be a little bit more pointier and sharp to be able to pick off any of that hard calculus or tartar that is on the teeth. The curette is going to be used subgingivally, meaning it's going to be used below the gum tissue. And what you need to know with the curette is, depending on the type of curette that you're using, this, as you can see, the working end is going to be a little bit more rounded. It's not pointy like it is on the scaler, which is why it's going to be used subgingivally, because you don't want to stick something sharp below the gum tissue and not be able to see what you're doing, where this is a little bit more blunt and rounded tip, or the toe as they're referring to. So what you need to know from the curette is, depending on the type of curette you're using, it can be either two cutting edges or one cutting edge. Your universal curette is going to have two cutting edges on either side, and it's going to be universal because it's going to be used anywhere in the mouth, hence the word universal. Your Gracie curette is only going to have one cutting edge, and usually they're going to have, it may be double-ended, where you have one for the mesial side, one for the distal side, depending on the angulation, but that cutting edge is going to only be along this area here, rather than the universal that would have it along both edges. So difference between curette and scaler: curette has a curve to the tip, also known as the toe. Scaler has, it's pointy and sharp. Scaler used supragingivally, curette used subgingivally.